a very busy institution with a very busy emergency department, high acuity patients. So our Revolution Apex scanner is located right by our emergency department. In fact, it's much closer to the emergency department than to the radiology reading room. It's really right next door. It's been very useful to have it close to the emergency department because that represents a huge percentage of our volume, and especially our urgent volume that needs to be scanned quickly and efficiently. We really want to spend all our time when we're very busy reading cases, calling techs for missing reconstructions, or if the patient wasn't localized correctly. I think all of those things would add time that we don't have. We try to predict ahead of time cases in which we think the Apex is most likely to be helpful. So a hematuria scan, we know those patients would be best served on the Apex. If we're concerned about bowel ischemia and we're going to do a mesenteric ischemia protocol CT angiogram of the abdomen and pelvis, those patients, they would benefit from being scanned on the Apex. So as often as we can, I ask for those patients to go on the Apex. In terms of streamlining work, the effortless workflow with the Apex, and before that, which we got with the Ascent, really has been revolutionary. I think for the techs in particular, in terms of localizing the patients, getting the patient positioned correctly, getting the scan done correctly each time, and providing the correct reconstructions, it's been critical. So we don't need to rescan those patients. We get the reconstructions we want. We often don't need to bring the patient back for additional phases or non-contrast exams later on. The impact of effortless workflow is greatest on the techs. When there is a more streamlined process for them to go through, there's less variability and less opportunities for human error. I wish every patient was scanned on the Apex.